Madam President, I come to speak about health care, and I begin by paying tribute to our colleague from Arizona, Senator McCain, on his return earlier this week, and I wish him the very best as he begins a process of cure and treatment and a bright future in his life. And I appreciate the remarks that he indicated that were so heartfelt to his colleagues here in the United States Senate, and we welcome him back and thank him for his service to the United States Senate, to the people of Arizona, to the people of America. But I also thank him most especially for his service in the United States military. Another great hero in my life and in our country's history is my predecessor in the United States Senate, Senator Bob Dole, who earlier this week celebrated his 94th birthday. Service to Kansans and all Americans exemplify Bob Dole's life, and while I admire him for his time in the United States Senate, I respect him even more so for his service to our country during World War II, and for his efforts ever since then to care for those who have come into harm's way as a result of their service. I often see him at the World War II Memorial when there's an honor flight from Kansas or across the country, and he is such a role model for so many people. Again, I admire him for his commitment to other veterans and to making certain that veterans receive the care and the gratitude that they deserve. One of the most important ways that we can demonstrate that we honor those who served our country is by making certain that we live up to our commitment, the commitment that was made to them for the benefits that they deserve, including access to timely and quality health care. Unfortunately, today we find ourselves in another crisis moment in regard to veterans' health care, and in particular the Veterans Choice Program, which was designated to provide access to veterans who were in danger of an inability to access that care because either the VA didn't provide the service, couldn't provide it in a timely manner, or that the service was so far from where the veteran, he or she lived, that they were unable to attain that service because of distance. So in 2014, this Congress passed, the President then signed, what's been labeled the Choice Act. It came about in the wake of a scandal, particularly in Phoenix, but across the country, in which we saw fake waiting lists and the belief that there were veterans who died as a result of not obtaining the care that they were entitled to in the VA system. The Choice Program has helped thousands of veterans across the country, and especially those in rural communities where distance remains a problem. I've heard from many veterans in my state how important the Choice Program is to them, and instead of driving for 4 hours to see a physician at the VA, they can drive 4 minutes to see a physician in their hometown. This Choice Program was set to expire on August the 7th of this year. Just a few days from now, it was scheduled to come to an end. At the start of 2017, the VA estimated there would be more than $1 billion remaining in the Choice account that the VA told us would last until January 2018. And rather than let those funds expire, I joined Senator McCain, Senator Isaacson, Senator Tester, and others in a Choice extension bill to remove that August 7th deadline and sunset the program until the funds expired, which, as I said, was believed to be in January of 2018. The President signed that bill on April the 19th, but less than 6 weeks later, we learned from the VA that the VA had made unfortunate miscalculations, and as a result of poor budgeting and finance, the dollars for the Choice Program were not going to last until January, but are soon to expire, just within the next few days. Demand for the Choice Program was up 30 or 40%, and it's clear by that increase in demand that veterans needed choice, that they like choice, that it's working for them. And we now owe it to those veterans to make certain that that Choice Program continues and that the funds are available to accomplish that goal. With choice, the funds that they had anticipated that would last until January, now it will run out sometime in August, we think in the next couple of weeks. Those depleted funds will mean that Kansas veterans and veterans across the country who have been using the choice program will no longer be able to. And it means those that could use the choice program into the future will be without that option. We run the real risk, it's the likelihood is almost a certainty that the choice program will be discontinued in a matter of days. When I learned the budget miscalculations, I chair the appropriations subcommittee that funds the Department of Veterans Affairs, and we immediately contacted the Secretary of the Department to get his understanding of the circumstance that we were in. We only learned of the shortfall after we learned that veterans at home were being denied access to the choice program. The Secretary had made a decision to reduce those veterans who are eligible, and we asked him to withdraw that guidance to his regional officers across the country, and he did. However, when the Secretary then testified before our subcommittee, the Subcommittee on Military Construction and Veterans and Related Agencies, we learned that new guidance had been issued because of the fear of depleting those dollars. It again limited the access to veterans for the choice program. We now hear of veterans forced to drive hours to get appointments at VA facilities when just 2 weeks ago they were receiving that care in their hometowns, in their neighborhoods, nearby opportunities that no longer exist. Dr. Shulkin and the VA recognized that their projections and budgeting were off and must be fixed. I hope that turns out to be the result and that we have better ability at the Department of Veterans Affairs to make calculations necessary for Congress and the Department to make wise decisions. The system has to be fixed, and it has to be fixed quickly. There's an immediate crisis. One of the things that now happens as a result of reduced use of choice is that the networks that were created to support choice, the third-party administrators of the choice program, because of lack of volume, no longer are financially viable to stay in the business of being the network to connect the VA, the private sector, and the veterans in a way that cares for those veterans, gets them their appointments, and establishes the payment process by which the provider, the physician or the hospital is paid. Now, this is not just a circumstance in which the third-party administrators can leave the business and return if we get our work done here and the VA choice program is refunded. Those networks will disappear, and we will not be able to easily restart the choice program. So if we don't make a fix shortly, today, tomorrow, by the weekend, if we do not pass legislation in a timely fashion, it's not like we can come back in September and say, okay, let's appropriate the money now and choice can restart. It will not happen. Choice will be gone. There are big consequences at play for the future of community care. The funding crisis and the inability to sustain choice risks shutting down, shuttering the entire networks, and it will diminish the faith that veterans and our providers were slowly beginning to have in the choice program. Early in the choice program, many veterans were discouraged because of the bureaucracy and paperwork associated with choice. Providers then weren't often paid in a timely fashion, and they became discouraged by the program. And in recent months, that confidence in the program had returned. Veterans were beginning to get their care at home. Providers were being paid for the services they provide veterans. And now if the third-party administrators, the network goes away, we will send one more message to veterans and to those who wish to serve them, the healthcare community, that the program is not a viable or valuable one. Fortunately, both the House and Senate have been working to fix this situation. Since June, my colleagues on the Senate Veterans Affairs Committee have joined me in working to find a solution that protects access to community care for veterans. The Choice Program is funded by mandatory spending. We have also been working with the House as they've tried to develop a solution that maintains choice and that is fiscally responsible. There's a lot of back and forth, a lot of conversations, a lot of talk, and a lot of negotiations going on. And I support the efforts of our chairman and ranking members of the Veterans Affairs Committees, both in the House and Senate, who are trying to work on an agreement to come together for our nation's veterans. I would hope and I expect that a bill will come from the House yet this week. My point to my colleagues here today is that we do not have the luxury of then trying to figure out something different to do than what the House sends us. We need to have our plan in place, and we need to have something that can pass both the House and Senate in the next 2 days. I want to motivate my colleagues to do what is right for veterans and set aside the differences that have prevented the necessary cooperation to see that we have one bill that can pass both the House and Senate and save choice. I stood here in 2014 to implore my colleagues to support the passage of the Choice Act in the first place, and I stand here again today to implore my colleagues to come together and support passage of this critical funding for the continuation of the Choice Program and community care for veterans. I'm here to make certain that we end the delays and find a way to understand the differences and accept that we must act quickly on behalf of veterans. It has to happen immediately. We owe our veterans better than what we've been providing them, which is I'm once again partnering with my colleague, the senator I honored in my opening comments, Senator McCain, and others to introduce legislation that will put funds back into the Choice Program, making certain that our veterans do not experience a lapse of care at home or a termination of the program. We are working hard with our colleagues across the aisle and in the House to determine the future of this program and what community care will look like. While we work to create that system that will serve future generations of veterans for years to come, how we make choice better, we cannot allow the program to expire at this critical point in time. Taking care of veterans must be a priority above any one specific ask or must have in the funding. Not acting is not an option. Senator McCain's words upon his return to the Senate remind us of the importance of this task and many others before us. I'm honored to work with him on this effort to save choice and to serve our veterans. I ask my colleagues to help us save this important program that benefits rural and urban veterans, that makes care more timely, that provides care in the circumstances in which the VA does not have the capabilities, either in a timely or quality fashion, to provide the services to veterans. This doesn't diminish the role or necessity of the Department of Veterans Affairs or their hospitals and clinics across the country. Veterans continue to use a VA hospital, continue to use our outpatient clinics, but we ought not allow the elimination of the third opportunity for veterans care, the Choice Program that serves so many veterans in so many communities. Again, I thank Senator McCain for his leadership and his bipartisan work that had originally created this program, this opportunity with Senator Sanders. We seek a partnership, a bipartisanship, to put veterans first and to put their health care access above everything else. I'm urging my colleagues today to know this issue exists, not to walk away from it, make certain that we accomplish our goals that this critical funding be provided before we depart for the weekend. Preserving this important benefit honors our heroes, Senator Dole, Senator McCain, and the thousands of Americans who didn't ask about whether it was Republican to serve the country or Democrat to serve the country, who believe that serving their country is what motivated them to see that their families were safe and secure, to see that America had a bright future. We ought not deny them that kind of service today. Madam President, I thank you for the opportunity to address the Senate.